My name is Dr. Christina Vallen Malichewe. I'm a clinical oncologist, a medical oncologist, and a lecturer at Muhimbili University of Health and Allied Sciences. Currently, I also work with Muhimbili National Hospital, Clinical Oncology Department, but also Ocean Road Cancer Institute here in Tanzania. And I went for a medical oncology fellowship in Tata Memorial Hospital in India under Merck Foundation. Okay, while I was in TMH, as I said, I was doing medical oncology fellowship, and the course was intensive, and it was there was a lot of evidence-based studies, information, and it could include clinical part and also research. And I learned a lot through classes which I joined with the resident at TMH, but also through seminars, conferences, and workshops that I attended at TMH. All these together with research trainings, there were a lot of, they did impact a lot of information in me, and this had helped me a lot in my career as an academician, but also as a clinician. After completing the medical oncology fellowship from Tata Memorial Hospital, I came back, and the first thing I did was to join my fellow oncologists at Muhimbili, and I will continue doing clinical work to our patients. But also, by that time, Muhimbili at Muhas had started a new facility. We called it Mloganzila. Then there I started a new clinic, oncology clinic, that was caring for cancer patients. But also I managed to open a new clinic in a private hospital, which is still going on till today, caring for cancer patients. And at TMH, I learned a lot about issues of caring for patients and improving their quality of life at the end of the day. So I rotated also at the palliative care unit, and this moved me more to impact my fellow healthcare workers with palliative care knowledge and skills. So I started a new and an introduction course in palliative care here at MUAS, which was not there before. And currently we have trained healthcare workers about 114. And these are healthcare workers from different range of works, from primary healthcare facilities to specialty facilities, and they are coming from all over the country. And the course still going on. And another thing which I've done is facilitating or teaching oncology or medical oncology subjects to undergraduate and postgraduate students. Okay, the course has impacted a lot in my community, personally, first of all, to my university, and to the Tanzanian community as a whole. To me, it has increased my career. It has brought a new interest, I can say, as in palliative care. Now I have decided to pursue my PhD in palliative care, but this was more enriched when I was in TMH after rotating into a palliative care department. But also research-wise, as I said before, I'm looking at one project looking at the awareness of risk factors of cervical cancer in women in our environment. And so far, I've seen that the awareness of HPV infection and vaccination is very low among our women. And thinking of creating or doing something to increase the awareness of cervical cancer, of HPV infection, but also vaccination. We know that vaccination, HPV vaccination, prevents women from getting cervical cancer, and still we can see that very few who are aware of it, and still those who are getting it, they are not getting it in full doses. So we need to formulate or to find some strategies that can increase the awareness of HPV vaccine to women in our country. So, but also the cause that I've started, the palliative care cause. We know palliative care cares for patients with life-threatening illnesses, and it's not only about cancer, but life-threatening illnesses. You can get them from cardiovascular disease, respiratory diseases, renal diseases, liver diseases, and all these patients, they need palliative care. So giving new skills and knowledge to healthcare providers who can care to these patients with life-threatening illness. Some of them, they cannot reach the hospital, but it can be cared of and be given a good quality of life where they are. So this has, for me, has impacted a lot, and I could see participants that have come out of this cause giving me big feedback of taking care of very people in the village who have nowhere to come to the hospital, but they're giving them hope and hope, and also caring of their pain, so that they can live a very good quality of life in the remaining life that they have. This cause has given me a lot. So giving it to another colleague is a benefit not only for me, but to our society and to the Tanzanians. So yes, I will refer this to my colleagues, and since I came, I motivated some other doctors also to go for fellowships like this, for specialization fellowship. For example, surgical oncology, we have Dr. Koko, who was also, pursued by me to go for that course, but also there are other courses that are needed to our country, specialized courses that will improve quality of life of our patients. I'll give my special thanks and gratitude to Merck Foundation for giving me that opportunity. That is a lifetime opportunity for me that I was given, and it's not only for me, but for my university and also for Tanzania. And thank you, Senator Rasha Kelej, for giving us hope, for giving us support throughout the journey that when we are doing the fellowship. And I would like for Merck Foundation to do more in our country.